Hello everyone, my name is Jordan Heimerman, and today we will be discussing fall prevention strategies with the first 4 steps of the Precede model. As you can see on this slide here, the Precede model is actually an 8-step total program. The first 4 steps are with Precede, with the last 4 being in the Proceed, or actually implementing what you're wanting to implement. The overall goal of this model is to address health and community issues. So overall, you're trying to identify what a problem is and then help implement something to solve it using this model. In this presentation, we're actually only going to be doing the first half, the Precede, and not the Proceed portion. So Precede stands for predisposing, reinforcing, enabling construction, educational, environmental diagnosis, and evaluation. The process that precedes or leads up to an intervention is what this process is. In order to do this model successfully, you have to make assumptions about how to prevent illness and promote health. So the first assumption you want to make is that you must involve those whose behavior you wish to change. They do believe that involving the community from the very first steps is very important in actually solving the issue, because they are the ones actually experiencing the issue. The next assumption is that health is a community issue, so it's involved in the entire community, not just in hospitals, not just in clinics, not just individually, but within the community. Health is about the overall quality of life. If you can improve health, you can improve someone's quality of life because it directly affects how they live. And lastly, health is more than just your physical being or the absence of having a disease or an injury. It is so much more than that. This is the same concept that they use in care, such as hospice. If they viewed someone being sick in their last days as, oh, we need to get them better, and not the best outcome of helping them to be comfortable in the last days of their life, that would be viewing health as only their physical health. We want to view health as more than just that. So phase 1 of Precede is your social assessment. The goal of this phase is to define the ultimate desired outcome. What does the community actually want? What do they actually need? Oftentimes, common ways to find out what the community needs include community surveys, focus groups, phone interviews, face-to-face interviews, or questionnaires, things like that. The point they want to emphasize is really involving the community from the very, very beginning stages. For the fall risk, which is the topic that I'm focusing on for this model, research does show that a multi-step approach is the best solution for fall prevention. So, for example, you cannot just educate and hope that that works the best. It has been shown that education on fall reduction alone is not at all effective at reducing falls. Peer-delivered education may be better, but overall it does not improve it by much. So the goal would be having to combine education with other factors such as medication review, occupational and physical therapy exercises, and then use of fall prediction tools all together to help in fall reductions. Going on with this, adherence rates are super important to consider because it is directly involved with the community. In a survey to determine how willing elderly people would be to participate in fall prevention activities, more than 40% of people would definitely not attend group sessions of strength and balance retraining. So looking at this data, we have to ask ourselves why. Why does this happen? Why are older people more unwilling to go and to do this training and to get these things done? How can we educate these people and help them to improve their outcomes? Are home interventions better than group interventions somewhere else? What is the answer that we are trying to get to here? However, what we do know is that decreasing the overall fall risk factors is the best way to reduce future falls and increase those outcomes. If we can stop the fall from even happening in the first place, then it isn't even going to be an issue. So that is going to be our overall goal. Phase 2 of the Precede part of the model is your epidemiological assessment. So what we're trying to do is identify the issues that are causing our problem we want to prevent. These factors are not only, the bad behavioral factors, but they're also the good factors that help prevent the issue we're trying to prevent in the first place. And these are important to pay attention to because these could be implemented into our preventative measures in the future. So first, we have our behavioral factors. Second is the lifestyle factors, and third is environmental factors. So in our behaviors, exercise, vitamin D diet increase, and education about fall prevention all have been shown to help reduce falls. However, in our risk behavior category, we have overall carelessness, improper device use such as not using walkers correctly, using furniture to get around instead of a safe cane or a walker, things like that. And then actually having incorrect footwear. Some people need certain types of shoes or have incorrect fitting shoes, and that actually does lead to more falls. Next up, we have lifestyle factors. A very interesting statistic that I found is with smoking status. So they did a survey on some elderly population, and current smoking actually associated with 24% fewer falls compared with people who have never smoked before. I did find that very interesting. And then going outdoors at least twice weekly actually helped prevent falls. With the risk lifestyle factors, you have being afraid of falling does actually lead to more falls. And then high physical activity with at least one activity of daily living deficit was actually shown to increase fall risk. So more exercise is not necessarily good if you do have certain deficits. So that's definitely something to look into. Lastly, there are environmental factors. So good factors that we have here are in the house, creating clear and wide paths with no obstructions, and then making overall home modifications, such as adding in a shower chair or bars in the hallway just to kind of help add some support. And then we have risky environmental factors, which include home obstacles such as a frayed rug or just things in the way that can cause tripping. And then just that lack of helpful devices in the home. So not having a shower chair, not having handles in slippery areas like the bathroom or the kitchen to help keep that balance. Our third phase of the Precede process is educational and ecological assessment. These are influential factors that actually relate to our phase 2. So these factors are what affect those other risk factors in phase 2, which is why they're called influential factors. There are so many factors that could be included in this, but I did try to focus on some of the main ones that I could think of. So we have first here, knowledge on the risk of falls. Education, while not alone being effective, is still very important overall. Some people don't even know that a simple thing as a rug in their home could be what is increasing them as a risk for a fall. And so just small education on things like that is really important. Age is also a really big influential factor, just because a lot of the physical capabilities, exercise, things like that do have to do with age. And that is something we have to pay attention to. Attitude and values are also really important here. One statistic that I found is that never married males aged 66 to 84 years accept relatively simple fall prevention measures as little as 30% of the time. So the question that we have to ask ourselves is why? Why is this age group of men not as willing to accept education and measures as willing as maybe other populations? We may have to delve deeper into their attitude and values. The next one is confidence on avoiding falls. As I mentioned before, the fear of falling is a fall risk itself. So how can we change the mindset around to avoid other risk factors as well? We then have kind of a two-part one is the availability, accessibility of resources, and then the physical and mental capabilities. So, does this person even have the insurance or money available to help them get the preventative measures that they need? Physically, can they drive a car to get to a support group? physically, are they able to walk or exercise at all? Mentally, does this person live alone and have dementia? Can they even remember to keep an appointment? These are all very important, influential factors to think about. And then lastly, we do have outside influences. So is their family supportive of them? Will they be willing to help them get the help they need? Are they in a location that even offers these type of measures? Sometimes those that live in rural communities don't even have access to a bigger hospital or even a clinic that can help them get the help they need. Lastly, we have Precede Phase 4, which is administrative and policy assessment and intervention alignment. So what we're looking for here is, are there policies in place or are there policies against the interventions that we want to implement to help prevent our issue? I know personally, just from working in a hospital setting, unfortunately, the system or the healthcare system overall is sometimes built more on reaction rather than proactively preventing a problem from happening. So in the hospital, we'll get patients who have fallen at home. Well, at that point, it's too late. The problem has not been prevented. Now, we can help prevent another fall from happening. However, the bad part with falls is that sometimes it can be too late. You can severely injure yourself. Some people even die from falls. Some people break hips. So it's really important that we get in these first steps and prevent it from happening in the first place. Another two that somewhat go together with the administrative section here is funding and collaboration. So you have to get multiple groups in and agreeing on ways that we can help prevent these falls. And unfortunately, money does talk. Funding is very, very important. The National Council on Aging did request from Congress a minimum of $10 million for older adult fall prevention. This was done very, very recently. And they do have data to back this up. So the programs they are wanting to implement include the balance program, and things like teaching Tai Chi or doing physical therapy in the home, things like that. They are 97%, those that participate are 97% more confident discussing their fear of falling. There's a 35% reduction in fall rates with these programs. And there's also 75% fewer injurious falls when implementing these programs. So using this data, they're hoping that they can gain the funding. If these administrative things can be figured out, that can then lead to implementing the actual interventions for reducing fall risks. So like I just mentioned with the balance programs, you have the exercise, they're called stepping on, Tai Chi, Otago, and a matter of balance. And like I said, those statistics do speak for themselves in helping reduce falls. Increased education is also really, really important. So when someone comes in, either inpatient or for an outpatient, we do need to educate them along with implementing other things with the education. And then lastly, we have screening tools, which are really important. So things like the Morse fall scale, which are used in inpatient settings, and then the STEADY algorithm made by the CDC used in outpatient settings. And the STEADY algorithm looks at things like, is their medication making them dizzy? Are they wearing the right shoes? Are they having vision problems? And they compile all these things and make sure that their fall risk isn't at a certain level. And if it is, they're going to make sure that they go to the eye doctor and get that fixed. They're going to make sure that they get those new shoes that they need. And they're going to help make sure that their home is a safe environment. So all of these interventions are going to be super important for reducing falls. That is the end of my presentation. Thank you for watching, and I look forward to putting this information together for the final project.